Since childhood, I've always been a planner, organizing my days to be efficient and practical. But as a doctor, your time isn't your own, and it can feel like you're being pulled in a million directions. Phone calls, notes, medical emergencies, anaphylaxis, a code blue. Walking into the hospital in the morning, you have no idea what's coming. Morning guys, I'm Siobhan, a second-year medical resident. I just got to the hospital. It's actually a couple minutes after 7, so I'm kind of running a little late, gotta hurry. And I'm just meeting up with my staff physician, and we're going to be seeing the new patients that came into the emergency department overnight and get to know them. In the morning, the resident or medical student who was on call last night tells the attending physician all about the patient they admitted, including their diagnosis and then their plan. This is the moment that a lot of us get feedback and teaching, and as a medical student I actually found it nerve-wracking, but now this is an opportunity that I really value. Okay, so it's just about 8. Why don't we just go and grab some coffee before we go to teaching?
That sounds great.
Okay, it's my treat because you've done such an amazing job. Grace actually came in early to do a consult. She's an elective student and she's doing an awesome job. It's great to have her here.
Thank you very much.
Okay, need sustenance. All right, got our coffee, or tea. You got your coffee. Perfect, teaching time. This morning we did simulated scenarios focused on how to manage common emergencies we see in the hospital. So now it's time to meet up with the poor, exhausted resident who was on call overnight and hear about any issues that came up with their patients so that we can follow up with them during the day. Oh, hey guys, are you guys printing the lists?
Yeah.
Awesome. Okay, perfect. Hey how was the night?
Oh, it was pretty busy.
Yeah? How many consults?
5.
5 consults? Seriously?
5 overnight, yeah.
Oh my gosh. How many do you end up, you had to do 5 yourself?
Yeah.
Shoot, okay.
I think the team had like 20.
Oh my
something like
gosh.
That. Yeah.
That's a busy night.
Yep.
Okay, we'll get handover from you soon so that you can head on home and get some rest.
Yeah, I would appreciate that very much.
Next, I assigned each medical student and resident specific patients to see, and I always like to emphasize which patients actually need to be seen first, so whether they're the sickest or they're actually doing well and they're getting ready for discharge. So we've got 2 patients downstairs who are ready to go home. One of them had a heart attack, had a stent placed to open up their blood vessel, and now is doing really well, ready to go home. The other one came in confused, and we've sort of fixed the underlying cause, which was some electrolyte abnormalities because of a medication. So I'm going to go downstairs to meet Jennifer, one of our excellent medical students, and she's getting things set up, so I'll help go through it with her and sign off on the paperwork that she's done. I got paged about a patient with a new rash. When I arrived to see her, she told me that her chest was feeling a bit tight. And then talking to her nurse, I found out she was just receiving her first dose of an IV antibiotic. So we checked her vitals, and luckily they were all normal. But on physical exam, I found her lungs were wheezy. And she had no history of asthma or lung disease, so it shouldn't sound like that. I'm really concerned she's having an allergic reaction to the medication. So immediately, we stopped the antibiotic, and we even took out the IV that it was running into. Then we gave her some epinephrine, just like an EpiPen, and we gave her some Benadryl and ranitidine, and a steroid called Solumedrol. Then I ordered some blood work to rule out anything else that could be causing this. I was so relieved when her symptoms started to quickly resolve, and her lungs no longer sounded wheezy. Okay. So the situation is resolved, but I do want to call family and just update them and let them know what happened, and that the patient is safe and okay, but I'm sure they'd like to see the family. Okay, great. Okay, we'll see you soon. Okay, so really lovely family, so they've been updated. I'm also going to text my staff physicians so that they're aware of what happened. I make sure that the chart, they know this is an allergy, or what we're thinking is an allergy. And I'm actually going to move this patient to an OBS bed, meaning an observation bed, so they're on closer surveillance, and just make sure that their breathing is okay moving forward, and we can have attention very quickly if anything happens. So guys, I really want to stress how incredibly important it is to take allergies seriously. So I actually grew up with a deathly allergy to milk products, and I was fortunate enough that I grew out of it, but I used to carry around EpiPens and I never wanted to, and my parents had to get on me. So I just want to say, if you have an allergy, it is so important to carry it, and if you need to use it, you use it, and you don't carry around ones that are expired. All of this is critical. So yeah, I really can't stress it enough, especially when you see someone as sick as this patient was. So I just finished up lunch and noon hour teaching, and now I'm heading down to the, I guess, health and wellness center here. And the reason is because I need to get a TB screening test done. Basically, I have to go on away electives, meaning I go to a different university, a different hospital, and I do an elective in an area that I think I may want to pursue a subspecialty in. And so I'm going to be doing rheumatology at a different hospital, and they require the TB screen testing. So maybe I can show you guys what that's like. I don't know, have any of you guys had one of those done before? The TB skin test is an intradermal injection. So fluid with some purified protein from the bacteria is injected under the skin, and it actually raises up like a wheel. Then you come back in 2 to 3 days to have it read as positive or negative. But the good news is that TB is actually curable. So the important thing is just finding out if you're positive so that you can get treatment. Okay, so just finished up with that code blue. Turned out it was a patient who was having a seizure. So we gave a fair bit of Ativan, stopped the seizure, and then sent off a bunch of blood work just to make sure we know the cause. I think in the end this actually was probably due to alcohol withdrawal, but we're gonna just do a full workup, or actually the team looking after this patient is gonna do a full workup, because I was just there as sort of the code blue captain today. Yeah, so anyway, I guess I get to just go on with my day seeing our patients at this point. Heading to meet the team now to review all the patients that everyone saw during the day. I've seen most of them, so I'll have my opinion and we can see if there are teaching points, or if we all have the same opinion. I don't know, that usually doesn't happen. It's almost 6 p.m. I'm having a little bit of a snack. I'm on bridge, so that I'm bridging the day and the night, which means I now have to go down to the emergency department and do a consult before I can go home. So, off I go. Just finished for the day. Ended up being actually a pretty simple consult. Patient came in with really high blood pressure and high sugars because the patient had stopped taking their medications for the past year, and so we just needed to get him started back on them. So don't forget to subscribe if you want to see more videos like this. Check out these videos if you want to see more in the hospital on call. And otherwise, I'll be chatting with you guys next week. So bye for now.